Trenton State Hospital, 1924. The hallways are dim. In the air, there is no antiseptic smell, only blood. A young woman lies on a stretcher. Her name is Eleanor. In her eyes, fear mixed with a strange surrender. Her family stands nearby, desperate people who only want her to get better. And before them stands a man in a white coat. Dr. Henry Cotton. There's a low, distant hum. In one room, someone's teeth are being extracted. In another, the harsh buzz of a saw cutting into a colon. Everything is ready for Eleanor's operation. Dr. Cotton slips on his gloves, murmuring to himself, "Infection. Yes, the problem is here." His assistant asks, "Where exactly?" Dr. Cotton looks down at the woman's abdomen. "We'll find it." Eleanor's eyes slowly close. In that moment, her life fades to black, and a new line is already waiting in her file. Infectious focus will be explored. This scene is fictional, but what happened is the exact truth. In those years, Dr. Henry A. Cotton performed this same treatment on hundreds of patients at Trenton State Hospital. At a time when psychiatry was still undeveloped, Cotton believed something radical. Madness was an infection, schizophrenia, bipolar disorder, depression. To him, all were caused by hidden microbes inside the body. And the solution in his mind was painfully simple. Cut out the infected part of the body. He believed in this idea so strongly that he began removing his patients' bodies, piece by piece. Dr. Cotton's first target was the teeth. Every patient who entered the hospital underwent the same process. Rotten teeth, suspicious teeth, and even perfectly healthy teeth. All were extracted in a single session. Patients were tied down. Their screams echoed through the hallways. Buckets of blood overflowed. And when the expected recovery didn't happen, Cotton always gave the same answer. Then the infection must be somewhere else. For every patient who didn't improve, his surgical checklist expanded. Tonsils, sinuses, adenoids, appendix, gallbladder, spleen, sections of the colon, uterus and ovaries, testicles. Yes, the records really say this Cotton removed women's reproductive organs because he believed they were sources of infection. And for men, removing the testicles became a standard procedure. Patients like Eleanor existed in real files. For example, in the 1920s, one woman underwent complete dental extraction, then tonsil removal. When she didn't improve, her ovaries, then her uterus, then part of her colon. The woman died days later from infection. Cotton's report was brief and cold. Treatment unsuccessful. New focus must be investigated. Cotton proudly claimed his success rate was 85%. Medical journals praised him. Newspapers called him the doctor who conquered mental illness. But behind the scenes, when independent investigators later examined the records, a horrifying truth emerged. The real mortality rate was 30 to 45%. Nearly 1 out of every 2 patients died from his surgeries, and those who survived were often toothless, missing organs, traumatized, unable to talk, unable to walk. Yet Cotton listed many of them as cured. Years later, when researchers opened his archives, they found falsified success rates, missing death reports, ignored complications, operations with no scientific basis whatsoever. Today, Dr. Henry Cotton is considered one of the most disastrous figures in the history of medicine. Eleanor's story may be fictional, but the people like her were real, and it reminds us of one thing. Science in the wrong hands is not a light. Sometimes it becomes a blade.